So for your PA school interviews, should you talk like a normal person, like you normally do? Or should you be like super buttoned up, super professional, talk perfectly? That is kind of what this question is in regard to. So this person commented on Tiffany's mock interview, which she was super nice enough for us to post and to watch from a couple years ago. And, you know, she speaks usually super duper professionally. She's very well spoken. But a couple of words she says, like ask, she says ax. For specific, I think maybe one time she said like Pacific or something. I don't know if she misspoke or if she talks that way. But this person commented and said, you know, she needs to fix the way she says those two words and also do some other stuff. So I brought James Moore, PAS2 at Rutgers University on right now to talk about this for a second because I think it's an important topic in 1 second. So first things first, James, what do you think about all that?
I thought that particular user was being a little nitpicky. The second part, I actually agree with them. You know, as far as putting your answer around in the back to PA, you want to do all your answers like that in your interview because that's the whole reason you're there, right? But as far as saying ax or Pacific, that's kind of being nitpicky. I feel like it's being a little, you know, just a little. If it's just almost like if you had to complain about something, you're finding something to complain about. You know, I feel like being a normal person and talking like that is maybe that's where you're from. And it's not like she's using slang or something they haven't heard of or anything.
Yeah.
It's
just how she pronounces certain things. Yeah, you're right. That's a good point. It's not slang.
Right.
She's not like saying anything that's offensive or anything that like somebody may not know what she's talking about.
Right.
It's just how she says certain words.
Right.
It's almost like an accent.
Exactly.
It's like telling someone with like a Spanish accent, like, hey, don't you say it like that. Like, bro, that's how I talk.
Exactly.
You know?
There's a difference between an accent and then talking how you do in the streets with your friends.
Right.
Huge difference. And this is the earlier regarding the accent. And so, like, cut the girl some slack. She sounded extremely professional. I thought the interview was great. And so I respectfully disagree with whoever the user for them to say that and display that.
Yeah, and we're not like giving you crap. We're not lighting this person up.
No.
But I actually think it's an important conversation because the whole thing with like increasing diversity in medicine, like people from different areas that are not represented in medicine, Hispanic community, Black community, rural community, like me and Riley talked about, those folks in those communities talk differently than like your suburban, you know, whatever community, the Cleveland accent as they call it. So one, you can't just expect someone to not have an accent. Two, people from their community might feel more comfortable with them if they do speak with whatever accent that they do have, right? So I thought it was kind of an unnecessary comment. You know, she's probably not going to change her entire vernacular.
Neither should she.
It's just going to stress you out.
Right. And the other thing is regarding with patients that may talk, you know, a little different or whatnot, it's important to get on the patient's level. When you're a provider, you need to be able to talk to them on their level. They'll feel more comfortable with that, you know, with you in that regard. And so you may have to like, you know, you may not explain things into scientific mode up and up. You know, they may be uneducated. They may not have as high education, especially in the rural areas. You know, some people may have went to high school and they went straight to work, or they may not have finished high school. So it's important to maybe simplify things and just talk on their level. It's not being disrespectful. It's their ability and your ability to communicate that information to a patient that may not have the education or understand to a higher level, to the fact that you can provide care for them in the way that they understand. So you can get on the same page, because at the end of the day, that's what it's all about.
I mean, if they knew things on your level, they wouldn't need you. And then you wouldn't have a job.
In a nutshell.
You know what I mean? Like, that's our entire job, is to teach people, educate people on their level about the things that we know.
Yes, sir.
And also, you know, prescribe antibiotics and Madrigal packs and whatnot.
There you go.
So yeah, just wanted to chat about that for about 2 seconds, and then maybe James and I will go live before dinner time.
Right.
See if you guys have any questions.
Check us out soon.
Yes, sir.